The flu season has officially begun. An annual flu vaccine is the best way to reduce your chances of getting the seasonal flu, and when more people get vaccinated, the less it can spread to others. Vaccination is especially important to those who are at high risk of serious complications from the flu. According to the Centers for Disease Control and Prevention, groups that are at the highest risk of complications include young children, people aged 65 years and older, people with chronic pulmonary, cardiovascular, and metabolic disorders such as asthma, heart disease, and diabetes. Anyone who is in constant contact with children and older adults, including caregivers, and pregnant women. Dr. Albert Brooks, obstetrician and Chief of Medical Staff Services at Washington Hospital, has an important message regarding the flu vaccination.
It's very important for a pregnant woman to get vaccinated because during pregnancy, her immune system changes so that she can accommodate carrying the fetus. This change in her immune system makes her more vulnerable to getting the flu, and the flu can cause maternal death, it can cause miscarriage, and it can cause birth defects in her fetus. So it's extremely important for her to get the flu vaccine. There have been news stories that indicate there could be a link between getting the flu shot and miscarriage. The study that was reported took place several years ago, and it involved 2 different years of getting the flu shot for the H1N1 vaccine. And this study just showed there might be a link, but it was not a causal study. It didn't show that getting the vaccination would cause the miscarriage. It was done for another purpose to see if there was a linkage. Because of this study, people are calling it into question. But currently, the Centers for Disease Control has recommended that there be no change in the recommendation for women to get vaccinated against the flu in the first, second, or third trimester, because that will prevent that woman from getting the fetus and causing severe illness if she gets the flu during pregnancy or possible miscarriage. If the woman has an allergy to eggs, she should not get the flu shot. If she has ever had Guillain-Barré syndrome, she should not get the flu shot. And if she is ill at the time that she goes for the flu shot, we would not recommend giving that woman the flu shot. I recommend that women go to the CDC website. It's the Centers for Disease Control website. They have excellent material and information. They talk about the study, and they talk about the fact that they're continuing to recommend for women to get their flu shot. It keeps them and their fetus safe.
You can get the flu vaccine at many health clinics, and they are also available at the Washington Urgent Care and the Newark, Nakamura, and Warm Springs clinics. Contact the clinics for availability. For more information about the seasonal flu and vaccine, please visit the Centers for Disease Control's website or Washington Hospital's website.